Well, good afternoon, everyone, and welcome to the program. I'm Carolyn Colley, and I'm president of the U.S. Chamber of Commerce Foundation. If this is your first time joining us, welcome. If you're a repeat viewer, we're sure glad to have you back. We've got some serious issues to discuss today, things affecting every American and our health and our economy. So I'd like to tell you briefly a little bit about who we are and why we care so much. At the U.S. Chamber of Commerce Foundation, our mission is to educate the public on how business does well, does good, and prepares for the future. Our entire team comes to work every day thinking and knowing that business is an essential problem solver. And that's become even more core to our value system since last March, when we pivoted just about all of our work at the foundation to working on COVID and the pandemic. Since then, we've hosted conversations and webinars and events with community leaders and business leaders from all 50 states and many countries for conversations on everything from executing responsible reopening strategies to planning for a post-pandemic world. And now, after many months of watching and waiting and hoping, the approval of safe and effective vaccines makes that post-pandemic world feel a little bit closer. But with that hope also comes the knowledge that vaccinating Americans is complicated and challenging, and we're seeing that play out every single day. I think, like many of you, I've been dismayed to see data like numbers we recently saw from the Kaiser Family Foundation that just 41% of unvaccinated adults say that they would definitely get the vaccine. And at the same time, we know, unfortunately, that to stop the spread of COVID-19 and its mutations, most of the population will need to develop immunity. So that raises the stakes for health officials and business officials and employers alike to make the case for vaccinations. To begin solving for this, we teamed up with Civis Analytics to look at how Americans are receiving and reacting to messaging around those vaccines. To be clear, all of us on this call have a serious and urgent responsibility. It's an obligation. We can shape the course of the pandemic with how we communicate and how we motivate people. It's serious work, and we know that messages matter. So I'm so pleased today that we're joined by experts in this field. We've got new research that we'll be releasing tomorrow, so I hope you'll join us for that as well. But let's get started. Thank you so much.
Hi, everybody. My name is Jenny Benz. I'm the Vice President for Public Affairs and Media Research at NORC at the University of Chicago and the Deputy Director of the Associated Press NORC Center for Public Affairs Research. I have some results from a series of surveys that we've been conducting for a number of months now that I'm going to walk through in a set of slides here, if we can go ahead and bring those up. If you're not already aware, NORC is an independent research institution affiliated with the University of Chicago, and we deliver reliable data and rigorous analysis to guide decisions across sectors. The AP NORC Center has been tracking pandemic attitudes since mid-February 2020. Our COVID-19 vaccine attitude data were collected using our probability-based panel that is representative of the US household population. And we've specifically asked about vaccine attitudes 3 times, in May and December of 2020, both before the vaccine was approved, and then in late January after the rollout of several of the vaccines had started. The results of each survey that I'm going to talk about today, they include interviews with just over 1,000 adults, and each one has an overall margin of sampling error of roughly plus or minus 4 percentage points. So quickly here, just to set the stage, we've been asking about people's concern about becoming infected by COVID-19 since February 2020. worry about the spread of the coronavirus increased quite rapidly initially. And in fact, back in February 2020, about a year ago, when this was all starting to percolate here in the US, concern about seasonal flu was actually considerably higher than concern about COVID. This concern increased pretty rapidly, but then has largely leveled off following the summer spike in cases. And throughout the fall and winter, roughly 4 in 10 Americans remained very or extremely concerned about being infected themselves or having someone in their family being infected by the virus. And another 3 in 10 are somewhat worried. As of December, most Americans told us that they were following news about the possible vaccines. 68% had heard or read at least something about the development and approval process. And when it comes to the sources of information about vaccines that they trust, healthcare workers were most trusted, followed by Dr. Fauci and the federal health agencies. Far more people lack trust in political figures, pharmaceutical companies themselves, and in the media. In December, as multiple vaccines were undergoing review for emergency use authorization, just 47% of Americans told us they planned to get inoculated against coronavirus when a vaccine became available to them. 26% did not plan to vaccinate, and 27% said they were unsure at the time. The survey from May, when the vaccine was far from a sure bet, found very similar results. So very little had changed as the development process was unfolding in the press. And even among the half that said that they would vaccinate, 57% told us in December that they planned to wait until others had received the vaccine to ascertain that it was safe, while 42% did say they would get vaccinated as soon as possible. And most of those who said they wouldn't get vaccinated were sure about that decision. 75% of that group said that their mind was made up, they were not going to vaccinate. Only 25% of that group said that they might decide differently depending on how things unfolded in the future. In a preview of some results that are coming out a little later this week from a survey that we conducted January 28th to February 1st, we see very similar patterns now that the vaccines are approved. We've changed our question a little bit to take in this new context that vaccines are actually available. And we see that there's still a decent proportion of the population who are on the fence about vaccinating. The survey shows roughly 10% already vaccinated, and we asked the rest about their intention once a vaccine to prevent COVID-19 is available to them. 4 in 10 said that they would definitely vaccinate, while 2 in 10 said they definitely won't. And the remaining 40% who haven't yet been vaccinated are on the fence, about 20% saying they probably will and 20% saying they probably won't. As we'll hear about more in the remainder of the presentations, this intention to get vaccinated varies considerably across partisanship, age, race, ethnicity, gender, and among levels of concern about being infected in the first place. Democrats, those who worry they or someone in their household will be infected. Older Americans are all more inclined to say that they will get the vaccine once it becomes available to them, while Black Americans are more likely than other racial and ethnic groups to say that they do not plan to vaccinate. And depending on the framing of the question, we've also seen that women are slightly more inclined to be on the fence about vaccination. The reasons for people's vaccine hesitation have been consistent from May, again, when the vaccine was far from a sure bet, all the way through our latest data. This chart uses the December data and shows the reasons provided among those who said they either would not vaccinate or weren't sure if they were going to or not. Concern about the side effects is overwhelmingly the top reason for avoiding the vaccine. 71% were concerned about side effects, and 37% said they were concerned about contracting COVID from the vaccine itself. Vaccine safety fears are also evident among the 57% who cited concerns with the development and approval process. These issues are somewhat unique to the COVID-19 vaccine. Prior research on vaccine hesitancy towards seasonal flu vaccine shows that people are more concerned about the effectiveness of the vaccine and a general sentiment that flu just isn't serious enough to need to be vaccinated. And as you can see toward the bottom of the chart here, these reasons are only cited by about 15% of the population when it comes to COVID. Motivations for why people do want the vaccine have also been quite consistent over time. This chart shows the reasons provided for vaccination among those who intended to get the vaccine as of December. And those planning to get the vaccine are doing so primarily to protect themselves and their families, but many also want to protect their community and believe that widespread vaccination is a necessary thing for life to get back to normal. 75% say getting vaccinated would allow them to feel safe around other people again, and that life won't go back to normal until most people are vaccinated. So to wrap up here, while about half of Americans say that they already have or definitely will get a vaccine, more are on the fence than steadfastly against it, which suggests that there is room for messaging, persuasion, and changing attitudes here. Looking at the reasons people do plan to vaccinate, protections against the virus top the list. Side effects are the chief concern among those who don't plan to vaccinate. And rhetoric and messaging focused on the rapid speed of development may be counterproductive to getting people ready to vaccinate. And again, as we'll get into, the disparities in intent are quite large, especially by race and ethnicity, age, and partisanship. And based on specific concerns among different groups, a one-size-fits-all outreach campaign may not be as effective as tailored messaging approaches. So our last slide here, which I think will be circulated after the presentations and the event, includes some contact information for folks here at NORC. And I thank you for your time and look forward to questions.
Hello, my name is Carlos Del Rio, and I would like to talk to you about the issues of vaccine hesitancy that we have heard a lot about. So, what is vaccine hesitancy? Vaccine hesitancy refers to delays in acceptance or refusals of vaccines despite availability of vaccine services. It is quite complex and is content specific and varies across time, place, and the type of vaccine. And it is influenced by such factors as competency, convenience, and confidence. So when I think about the spectrum of vaccine hesitancy, you have a part of the population that accepts all vaccines. You have part of the population that accepts vaccines but has doubts. You have parts of the populations that want to delay a vaccine. And finally, you have people who refuse getting a vaccine. And at the very end of the spectrum, you have people who we call vaccine deniers or the anti-vaxxers. And I think when you think about hesitancy, you really have to think about this continuum. And as you think about this continuum, you need to think about how you address different points on the continuum in order to decide which is the best intervention you ought to address. So what do we know about COVID-19 vaccines? Well, as Jenny said in her presentation, the data varies, but roughly about 45 to 50% of Americans right now says they will definitely get the vaccine. 24% said they probably. About 17% are not sure. 4% are not likely. And there's a 6% that are definitely saying, I don't want to get the vaccine. So when you think about these different segments, you think about different strategies. Those that say probably may have a very different perspective than those that say no, not likely. And the kind of interventions you need may be very different for each one of them. So who are the groups that are most likely to be vaccine hesitant? Well, interestingly enough, younger people, ages 30 to 49, rural residents, Black adults, essential workers, surprisingly, healthcare workers tend to be among the ones that have higher rates of hesitancy. Similarly, when you look about African Americans, again, it really determines, right? You have a large number of African Americans that are willing to get the vaccine right now, it's about 35%. But compare that to white Americans, where it's more like 53%. But then you have a large group of African Americans, the 43%, that want to wait and see, as opposed to 26% of white Americans. Why is that? Well, there are many reasons for this, but a very important one is there's doubts about the technology. There's doubts about the way the vaccine was developed. There's doubts about the fact that there's concerns about, because of the speed of developing the vaccine, some safety checks were not there, and we compromise a safety in because of speed. For Hispanics, this is a little different. Hispanics in general, their vaccine hesitancy is somewhat lower, but it is not for young Hispanics. For young Hispanics ages 18 to 49, it is more like 45%, so very similar to what we see in African Americans. And again, when you think about who they trust, and this was repeated before, but you know, the biggest trust factor in either Hispanics or African Americans comes from their doctor. It is their community doctor, it is their personal doctor that is going to be the biggest influence. And that tells us that we need to work with physicians, because it's the physicians in the communities that are able to tell people, look, I trust this vaccine, you should take it. After that comes, you know, local health departments, Dr. Fauci, but clearly it starts dropping from then on. And CDC is still not one of the most trusted voices out there. Now, we have seen over time that vaccine hesitancy is beginning to drop, but we continue to have a significant amount of vaccine hesitancy in certain populations. If you combine that with the fact that we're rapidly rolling out vaccines, what we're seeing nationwide, which is very concerning, is that Black Americans are significantly being vaccinated at lower rates of other populations, for example, whites. And let's put this as an example. You can have a state where the large percentage of the population is African American. A large impact of COVID has been in African Americans, but the proportion of vaccinated in the state who are African American is much lower than what you would expect. And we're seeing this across almost every city, every municipality, every state. And that is quite concerning, because as a result of that, you're leading to vaccine inequality. And vaccine inequality could actually make things even worse. So I think we need to be clear that it's not that Black people have an irrational fear of a new technology. It really is that they have an awareness and a long history of being disrespected, mistreated, and violated by the government and by healthcare professionals. And therefore, that mistrust is clearly grounded in a long history of events that include Tuskegee and many other events. So how do you increase vaccination? How do you deal with this? Well, the most important thing is you have to listen more than talk. You really want to hear what people have to say. You really have to hear their concerns. You have to listen to them. And then you have to give them information in easy, accessible ways. Number two, you have to work with trusted sources in the community to get that information across, whether it's community leaders, it's religious leaders, is opinion leaders in that community. And then you need to make sure that once a person is ready to get the vaccine, that there is vaccine availability, convenience, accessibility of services. Because if you make it hard for people to get the vaccine once they've been convinced, very rapidly, they're going to decide, well, I don't want to get it anyway in the first place. So you need to use that very small window to rapidly ensure that person can have access the moment they have decided to change their mind. What are the things that specifically we can do as physicians, as community, as business leaders? Number one, as I said, we need to address safety concerns. Number two is we need to cultivate trust. And trust takes time to be cultivated. Number 3, we need to deal with misinformation with conspiracy theories. And number 4, we need the community to participate. And as I and many others have said, when the administration says we want to do a million or 1.5 million shots per day, I always say that 1.5 million shots is one thing, 1.5 million shots with equity is a very different thing. So it is important sometimes to think that not only do we need to figure out in speed and numbers, but we also need to focus on equity. And for that, we need information, we need transparency, and we need data out there on what exactly is happening. I'm going to conclude by telling you that I was fortunate a couple of weeks ago to work with Tyler Perry, which is a leader in the African American community and who lives here in Atlanta. And Tyler Perry put together a special program that I would encourage you all to watch if you haven't. It's available on YouTube, and the Chamber will make this YouTube link available to you. But it is really, I think, a very good program that really is directed to the African American community and trying to dispel misinformation and myths about the vaccine. And I would again suggest that you use this program and you make it available to your employees and your peers and your community in order to dispel myths about the vaccine. And with that, I'll end and pass it to the next speaker.
Hello, everybody. My name is Frank Newport, and I'm a senior scientist at Gallup, after having been Gallup editor-in-chief for a number of years. And we at Gallup have spent a great deal of time looking at the types of things that we're talking about here on this program today. Jennifer mentioned in her review of the AP-NORC data the fact that partisanship was a significant variable that differentiated those who were more likely versus those who are less likely to say that they would take the vaccine. And then Carlos talked about some of the other groups, and particularly race and ethnicity groups, which also showed that kind of variation. In our data at Gallup, to give you a preview of what I'm about to say in these brief remarks, the partisanship is the most powerful of any of the variables that we've talked about so far. In other words, knowing a person's self-identification politically tells us more about the probability that they will get the vaccine or not get the vaccine based on self-reports than knowing any other factor about them, including age, including ethnicity and race and education. That's from our Gallup data. So we cannot ignore, as I'll say in just a moment, the powerful impact that partisanship has on what is a very, very important variable in our effort to increase vaccine uptake. I'd like to make 4 points here in reference to what I've just overviewed. Number one is that this impact of partisanship on the way that individuals look at the world is not new, and it is, of course, not specific just to COVID-19 or the vaccination. Over the decades, as I've analyzed public opinion data, I'm continually struck by the degree to which one's political orientation is a lens through which we look at the world around us and colors much of the way that we interpret the data that we see around us. I used to say prior to an election, as an example, that partisanship, of course, is the most powerful factor of all in the election, and that's a no-brainer. But when we get to a lot of these other variables, we say, aha, it's not just political issues, but many, many other issues in which partisanship plays a very powerful force. We are observing right now a dramatic turnaround in Americans' perceptions of the economy. As one example, it happens every time we have a new president in the White House of a different party than his predecessor. During the Trump administration, Republicans have been significantly more positive about the economy than Democrats, and now we are seeing a gradual shift, and we think by our updated data in February and then in March, we'll have a complete reversal, and now Democrats will be much more positive about the way the economy is working than Republicans. Those of you who are economists know that the economy hadn't changed that much underneath it all. We had not seen a dramatic change between December and February, but the lens with which people look at the world is what matters here. And with a Democrat in the White House, Democrats are much more likely to say, aha, the economy is doing well, and Republicans say the economy is doing poorly. Many other variables display this partisanship effect. Relevance to what we're talking about here, trust in the media is enormous. In our last data, we had about 10% of Republicans who said they had a fair amount of trust in the mass media. That compares to 73% of Democrats. This huge partisan gap there. Another question which I think is relevant to what we're talking about here in terms of vaccine hesitancy is perceptions of the government's role in society. We at Gallup ask a question about the government. Is the government doing things that should be left to business and industry? 74% of Republicans say yes, government is doing too much. More should be left to business and industry, and that compares to just 13% of Democrats. So a huge gulf there in terms of what the government should or shouldn't be doing in our lives. I'll come back to that in a moment, but that helps set the scene, I think, for what we're going to talk about here. The data on vaccine hesitancy, bipartisanship, as I mentioned, are substantial and significant. Jennifer from APNORC mentioned that they had found the same effect. She didn't give us numbers yet, but the numbers that we have at Gallup from our latest update show a 40 percentage point gap in terms of willingness to get the vaccine. And we add in those who say they've already received it. We have up to 7 or 8 out of 10, or even 8 out of 9 out of Democrats say they will get the vaccine or they've already received it. And that compares to just about 50% of Republicans. So we have about a 40-point gap in willingness to get the vaccine or actually getting the vaccine between Republicans and Democrats. And just to reiterate, if you didn't catch the drift of what I'm saying, it's Republicans who are much less likely to report that they want to get the vaccine or have gotten the vaccine than Democrats. Every other poll that I've seen which measures willingness to get the vaccine shows the same data. Republicans are much less likely to self-report that they will get the vaccine than Democrats. Now, this is very important because one of the things that the Biden administration and President Biden himself said they would be doing as they took office, and now that they have taken office, is that they would take politics out of communication and work on the virus. There's a quote from Joe Biden where he said, "Our national strategy on COVID is comprehensive. It's based on science, not politics." That's Biden speaking about his COVID-19 policy just after he took office on January 20th. The criticism was that much of the communication, in particular, about COVID and then about the vaccine from the Trump administration, Democrats pointed out, had political rationale behind it rather than science or evidence-based rationale behind it. What I meant by paradoxical, which I said a moment ago, is that I don't think we can take politics out of the process. We can certainly take politics out of the process of tailoring our communications to the people and not change or alter what we tell Americans, and by we, I mean healthcare and science professionals, not alter or change what we tell them about the vaccine, but base it on science and evidence. However, I think, and by this point you've gotten this drift, we have to take politics into account in developing strategies for overcoming vaccine hesitancy or increasing vaccine uptake. If we're going to reach a 90% target, which some have put forth for vaccine uptake, which would lead us to herd immunity, you're going to have significant percents of Republicans who take the vaccine. So it's a serious issue out there, as serious as the issues as Carlos was talking about in terms of hesitancy in the racial and ethnic communities of various types. I mentioned the data earlier about the media and the government, and that leads us to what can be done. The question is, what can be done to increase vaccine uptake, or phrased differently, to overcome vaccine hesitancy among Republicans? And I think we have to keep in mind as we begin that Republicans are much more likely to distrust media than Democrats. Republicans are much more likely to distrust elites than Democrats, and elites would include scientists, healthcare professionals. We find that Republicans are much more likely to distrust government in general than Democrats, as you saw in the data I mentioned earlier. And we know that Republicans, of course, goes without saying, are much more likely to distrust a Democratic administration and a Democratic Congress and a Democratic-controlled Senate than Democrats. So you've got a bunch of reasons here why Republicans might be resistant to the kind of messaging that we're talking about in this situation. So when people plan how they're going to increase vaccine uptake, we have to figure out ways of countering these kind of inherent distrusts that we find among Republicans who are most hesitant about getting the vaccine. The strategies for overcoming this, I think, would include many of the things that Carlos enumerated just a few moments ago, but they just need to be targeted directly to Republicans. Republicans, like anybody else, are more likely to trust their healthcare professionals. Particularly, Republicans are more likely to trust Republican leaders. The more Republican leaders and well-known Republican figures can be shown to be increasing emphasis on or encouraging emphasis on taking the vaccine, the better. And we also can look at channels for communication. Obviously, in today's bifurcated, polarized environment, we know that Republicans are much more likely than Democrats to use certain types of media, while Democrats use other types of media, and that includes internet, television, cable, radio, and so forth. So to the degree possible, if strategies could reach out directly through these media with targeted messages to Republicans, conservatives, that might have an impact overall on raising the percent of Republicans who say they will and ultimately will get the vaccine. So that summarizes it. We have a huge gulf in America today, and this is, of course, political science 101 between the way that Republicans and Democrats are looking at the world. That includes COVID-19, that includes the vaccine, and any of the strategies that we or companies or employers, as is the central thrust of this seminar today, employers and companies are going to have to take this into account and recognize that people's reactions to efforts to get them to increase their willingness to take the vaccine, I think, are going to have to take their politics into account. Thank you very much.
Good afternoon. I'm going to moderate a Q&A with our guests for the next few minutes. Please submit your questions and we'll try and get to as many of them as we can. Jenny, I'd like to start with you. Early on, you talked about time data. So data from, I believe it was May and December and January around vaccines. How much of the data that we have about attitudes toward vaccine is influenced by the fact that they're still not widely available?
Yeah, I mean, I think one thing that is telling in that situation is that we did have these two data points, one in May when we first asked about intentions to vaccinate if a vaccine becomes available, when there was really no, it was not a sure bet. I don't think anyone was gonna, bet their wealth on a vaccine for sure becoming available in 2020, let alone even into 2021 at that point. And so the fact that the intentions have been so steady, the fact that the disparities in intention have been so steady, and that the rationales for why people will vaccinate and why they won't vaccinate have been so steady at these three time points when there was no sure bet, when the vaccines were starting to go through emergency authorization. And then this latest data, which is basically from last week, which is, now that people are actually starting to get vaccinated and the rollout is happening, it's just been remarkably stable throughout the entire course of the development process. So I think for sure, there's opportunities to leverage what's actually happening with the rollout and, how few side effects there have been and some of these safety concerns to try and persuade those who are still on the fence and potentially persuade those who say right now that they won't get vaccinated. But I think the sort of underlying currents have been really steady. And we can't just lean on the fact that it's actually happening now to be the thing that's going to change attitudes.
Thanks. Carlos, we didn't mention it before, but you're a physician as well as someone who has a deep expertise in the issues we're talking about today. When you talk about hesitancy being higher among younger and rural and Black Americans and even healthcare workers and some other essential workers. You mentioned that there's a wait and see attitude, but can we wait? If you're an employer watching this, one of your questions is, how fast can we get back to business? How fast can we, in a responsible way, get people back to work? So how do we balance the wait and see attitude that some people are showing in these surveys with, a strong desire in the country and in the community to move forward as vaccines reduce some of the risk of transmission?
I mean, the biggest problem we have right now is an issue of supply and demand. We don't have enough vaccine yet available. And what happens is you're also in this, the people that are playing wait and see is actually the federal government, in the sense that we are telling states, wait. So sometimes when you try to address vaccine hesitancy, the challenge that I'm having sometimes is I can give a talk to university students and others, and I'll find some people ready to take the vaccine, but then if they cannot get it because they're not eligible yet and there's not vaccines, there's no point. Once you get those trendsetters to get a vaccine, maybe others will. But the issue we have right now is really not enough vaccine availability. And I think that really is playing a lot into what we're seeing, into this hesitancy and this wait and see. In fact, the wait and see is because of the hesitancy in great part. So what we need to do is try to vaccinate as many people that want to receive the vaccine now, and worry about those that want to wait and see later, rather than try to convince those, oh, you need to get the vaccine and hold the vaccines. And that's what many states are doing. They're telling healthcare workers, look, if you don't want your vaccine right now, we'll move to the next level. We're not going to wait for you.
So Frank, you've been doing this a long time. Have you seen, and we know that partisanship and ideology is often an indicator of different things, but have you ever seen anything as strong and as important as the data you're seeing when you look at attitudes toward vaccination?
Yeah, that's a good question. I would say yes. Let me give you one example: climate change and global warming. It wasn't always the case, but starting several decades ago, we began to see what I call the jaws of an alligator. Gradually, Democrats became more and more concerned about global warming, or in response to questions saying that it was a major factor in our way of life and could be a major factor in the future. Democrats increasingly were willing to respond in ways that suggested what I just mentioned. Republicans not so. In fact, Republicans got, in some instances, even less concerned. So we now, even to this day, although it's moderating slightly, have this enormous gulf in the way that Republicans and Democrats look at global warming and the impact of climate change on this country. So when I compare that to the vaccine situation and hesitancy about getting a vaccine, I think they're similar. So yes, this is, as I said in my talk, a symptom of this enormous partisan difference in the way we look at the world, rather than something that's brand new and shocking.
So one of our audience members asks, how do you encourage county health to be open about vaccine? I'd like to pivot that a little and talk, maybe we can explore a little bit the importance of transparency, and maybe start with you, Jenny. As you look at the data that you've gotten from these studies over time, have you found that transparency is associated with greater willingness? Like, is there anything in the data that would suggest a relationship between transparency and willingness to take the vaccine or to overcome some of the hesitation?
I think in the vaccine data specifically that we, this sort of overwhelming concern about side effects. I do think that in some of the reporting that I've seen recently, there seems to be a desire to try and balance, being transparent about the fact that, you may not feel great, you may have pain at the site of the injection, and sort of talking about the common side effects, making people aware that that's, part and parcel of the vaccine and normal and to be expected. So, not sort of putting on the rose-tinted glasses about the process of getting the vaccine, being transparent about what's expected to happen, while, making clear that these are not, overwhelmingly that the vaccines have been safe. And so I think that's an important part of the communications here. looking more generally at the communications research across a host of policy issues, I mean, we do see that transparency, in sort of the communication around different policy issues, and a little bit of transparency into the sausage making process can help establish trust on different policy issues and with different policymakers and communicators.
So there's a great question in here about how does the data about who intends to get the COVID vaccine compare to how many people get the flu vaccine every year? Are demographics similar? So Carlos, maybe I'll start with you, and then we can go to Jenny, because I think she might have some insight from other work that they're doing. But do you see similar levels of vaccine hesitation among some of the groups that you talked about being skeptical of the coronavirus or the COVID-19 vaccines?
You do, but I will tell you that in my hospital, which serves primarily an underserved population in downtown Atlanta, flu vaccine acceptance every year by employees. First of all, it's mandated to all employees in the healthcare system, so you have to take it. But number two, among patients, the acceptance is pretty high when the vaccine is offered. So offered leads to a lot of acceptance. With the COVID vaccine, there's still that sense of this is new, I want to wait. And I think that to me is a big difference, is that sense of still not trusting the process, not trusting the vaccine. So vaccine acceptance for flu is a little higher, even though some of the trends tend to be similar.
And Jenny, does that match up with your research?
Yeah, that's exactly. I would agree with everything Carlos just said. The patterns are very similar. What's different is that the rationale for the hesitancy is very different between flu and COVID vaccines.
Yeah, and one of the things that we in the Chamber Foundation have encouraged is that businesses make it as easy as possible for their workers to get the flu shot this year, but every year, because it's a critical way to prevent overloading healthcare facilities and doctors. So we would encourage everyone watching this to, if you haven't already gotten your flu shot, please go out and do it. Frank, when Jenny was talking, she talked about, she showed that we have lost trust in institutions. You saw Dr. Fauci on there, and in the CDC and the FDA, and the president and others had, kind of declining levels of trust. When you talked about trust in media being a factor. For the employers watching this, in some cases, they like to, at least they think that they are a trusted source of information for their employees. Are there in a society or a time when people don't trust government and they don't trust the media, or certain segments of society don't trust those groups, where should what are some of the lessons from the data or from your experience that employers should take into mind as they think about ways to communicate with people about vaccination?
Yeah, that's a great question. A couple of points there. One is on terms of media, overall, Republicans are much less likely to say they trust, quote, mass media than Democrats. So net, that's what occurs. But we do know that Republicans do trust certain types of media. So for an answer to your question, for employers and others, if they want to reach the segment of this that I'm talking about, conservative, ideologically conservative Republican employees, anything that is more likely to be a source of media they use regularly, conservative cable and all that, certainly would be a better way to operate than mainstream media. Now, we're talking about employers. I'm not sure, other than the huge employers, how much that's going to be germane, because they don't necessarily go buy ads on huge stations. But even though trust overall is down, keep in mind that there is trust on the part of Republicans in certain types of commentators, certain types of opinion leaders, certain types of media people. So we can keep that in mind. We also know that the trust in government gets higher and higher the closer to home it gets, which isn't an unusual phenomenon. We find that in a lot of different places. We say, how are schools in America today out there? Oh, they're terrible. How about the schools your kids go to? Oh, my schools are pretty good. So people are usually significantly more positive about what's local than what's national. And that's certainly true of government officials. So the degree to which local officials, as local can be used as spokespeople to get the message out, I think the better in terms of trying to convince people to go ahead and do it. I also had one other comment in terms of looking back in history. Interestingly, we were doing some research in Gallup over the years, I mean, way over the years, going back to the polio vaccines in the 1950s, has asked people about willingness to get a vaccine. And I think we asked about swine flu and some other instances where there were vaccines available. And we found this partisan difference that I'm talking about in several of these instances historically. So this is not a new phenomenon. Republicans have generally been less trusting of vaccines than have Democrats, going back quite a number of decades, at least in some of our research. So it's kind of a built-in structural factor, which is an answer to the question that I think you were asking earlier about, is COVID different or new?
No, thanks. That's fascinating. I mean, I think there's so much we can learn from our previous attempts to deal with public health crises. You know, we don't have to start from scratch. So an audience question has come in, and I'm not sure who the right person is to answer it, but I bet one of you has an idea. Has there been any polling on influencer culture, such as celebrities, athletes, et cetera, being effective at influencing vaccine hesitant populations, particularly 18 to 24 and 25 to 34-year-olds? Anyone want to take that?
I can say just we haven't looked specifically in the COVID vaccine context at influencers per se, but I mean I would caution people. I wear a survey researcher hat, 85% of my life. In the other part of it, I do a lot of experimental communications research, and I will say that oftentimes in sort of self-report of what people will tell you matters to them when they make up their mind about a big decision like this. People are quite likely, and we've shown this in a bunch of different policy arenas, people are likely to say that, influencers don't matter to me. It doesn't make a difference. They're going to say that on a survey. But when we look more experimentally in the communications research, manipulating the source versus who is sharing an article on social media and things like that, we see that the sharer or the influencer really does and can make a pretty significant difference in terms of getting people's attention and then engaging with a policy issue in different types of ways. So I haven't looked at it specifically with regard to the COVID vaccine issue, but certainly the influencers sort of in general in the communications literature can matter quite a bit.
And I'll just
I have one comment there. Yeah, Michael. Follow the money. If you look where the money's going today, in a lot of instances, I'm agreeing totally with Jenny there, it's going to social influencers. And these aren't celebrities necessarily, but these are people who, through hook or crook, and that's a fascinating question in of itself, how they do it, but they have millions of followers on YouTube and other social media. And that's where a lot of money's going now. If you're trying to sell a product, you pay one of these individuals and instantly they've got millions who are following them. So I'm sure wise people in the business of trying to increase vaccine uptake have taken this into account. But I think if that's where hard-nosed marketing money is going these days to these social influencers, it certainly would make sense that a lot of this reduction of vaccine hesitancy money should follow that path and go into the social influencers as well.
And we haven't talked much about this, but a lot of what's different also now in this pandemic is the role of social media. And, it is in Facebook, it's in Twitter, it's in Instagram, that you can have positive messages, but you can have a lot of doubters and a lot of negative messages and a lot of concerns about vaccines. I mean, the moment that Hank Aaron passed away 2 weeks after getting his vaccine, social media was full of postings saying he died because of the vaccine. It was really hard to combat that misinformation that occurred. And I think that's one of the biggest challenges that I think we still need to learn how to deal with is social media. You feel like you're going against the current at every single turn of the way.
I'm glad you mentioned misinformation. We actually had considered including a part in this 2-day event that we're doing focused on misinformation, and we ultimately decided not to include it because we think it requires its own focus. And if you look at the data, I think it was the data that you showed, Jenny, that people are concerned that they might acquire COVID-19 from the vaccine. Some of that might just be, a misunderstanding, but you can just have to look at social media to see that there are some people who are making a concerted effort to misinform. And employers, that want to help their workers make informed decisions about this need to be empowered with the tools and information and the best practices to overcome misinformation. So we're going to explore that. Before I move on to the next question, I did want to add one thing about influencers. The Reagan-Udall Foundation for the FDA did some interesting studies in the fall. And when they asked people, when they were trying to determine who are the right messengers, I don't have the exact numbers in front of me, but the family doctor was a multiple of 6 or 7 above a celebrity influencer when it comes to who would you trust to give you information that would lead you to make a decision about getting a vaccine. So I think that one of the takeaways, if you're watching this, is the importance of local health officials, local employers, local doctors. All politics is local. I think that's kind of the point Frank was making before. So speaking about kind of local, there's a question in here about how can we overcome vaccine hesitancy, especially in the healthcare field. Carlos, when you look at a healthcare facility like yours, or you look at some of the long-term care facilities that have had the opportunity, where workers have had the opportunity to be vaccinated since December, we saw relatively high rates of declination among those populations. Do you see any new strategies required to make sure that frontline healthcare workers are getting the shot? Or is it that when they see other people have taken it and haven't had adverse events, that that we're going to just see that naturally decline?
That's what we're seeing. That's exactly what we're seeing, is knowing that your friend, your colleague got it. And again, what we've seen in our healthcare system is about 84% of physicians, nurses, a little lower in the 60s, people working in the environmental services and others, lower in the 40% acceptance initially. But as time has gone by and they've met others and they haven't seen any side effects, people are beginning to say, well, I want to get the vaccine. I want to get the vaccine. So it just took some people a little time, and they wanted to, it's a whole issue of who goes first, and have others go first, and then they would jump into it.
So I have a question for all three of you, is as we kind of near the end of the program. One of the questions that came in is, what is the employer's role in overcoming employees' hesitancy receiving the vaccine? Now, understanding that not everyone is a physician, not everyone is a public health expert, but based on your area of expertise and speaking to the kind of folks who are joining us today, what advice would you have if you were talking directly to, let's say, a small business owner, and they wanted to make the case to their workers, or they wanted to help their workers get a vaccine when it becomes their turn?
Well, I think there's several things. Number one is I would be sure to make it easy for people to get a vaccine. Either give them a day so they can go do it. Sometimes the day after the vaccine, you don't feel well, so you maybe need to give a day off to people. But number two, you think about having a vaccination site on site as opposed to them having to waste hours to go get it somewhere else. I mean, make it easy, provide information, provide webinars or town halls in which you give information to people. And then, start from the top. Get the leaders to say, I am taking the vaccine, and give a reason why they're taking it, because those messages I have found to be very powerful.
Yeah, I would say one thing here, again, back to what I'm referencing in my remarks in this seminar today, and that is, in terms of Republicans and conservatives, the one thing that employers should not do is mandate it. I know there may be a legal question about whether an employer can mandate that their employees get the vaccine, and I'm not an expert on that at all, but whether or not it can be done legally or not, I don't think that Republicans and conservatives will react well to leadership of their company saying you must do this. So I would agree with what Carlos was indicating. Make it easy to get the vaccine, give people time off, say it's a great thing to do, but shy away from some kind of authoritarian mandate if your goal is to increase uptake among those in your employee population who happen to be ideologically conservative.
And I would maybe just echo what Carlos was saying as well. And add on that, it should be sort of a steady drumbeat of communication. This is not, show a video of the president of the company or some senior leadership getting their vaccination and leave it at that. But, to the extent that companies can sort of continuously provide the information and show the examples, show a diversity of employees at different levels getting it and talking about the experience. I think as we've been talking about, that local element really matters, and these trusted folks that can influence each other within your workplace.
So for the last question, I'm going to just throw one out there that I know from experience, scientists love to be asked to predict the future and base things on absolutely no data. But based on the data you've collected and the experience that you have, perhaps you can help us answer a vexing question that comes in on a pretty consistent basis. We're always being asked, when do you think we're going to reach herd immunity? Putting aside for a moment that we don't even know what the percentage threshold is right now for herd immunity. Looking at the data about vaccine hesitancy, at what point do you think we're going to have communicated and convinced people who are in the movable middle? Like, is this going to be a long process? Is this something that's going to take care of itself naturally in the coming weeks as vaccines become available? How do you think this is going to happen? Is it going to be a long, painful process, or is it just going to happen? Maybe we'll start with you, Jenny.
Sure. Yeah, I will. I'll cop out here a little bit and just lean on the data that we do have, which is to say that movable middle seems to really be bifurcated, and that about half of that movable middle is kind of leaning toward vaccine willingness. And they, based on the data we've seen when we asked about waiting and the concerns that they have, we do think that they will move pretty quickly once they see that this process is rolling out successfully. But the other half of that movable middle leans more toward vaccine hesitancy. And that group, it's less clear sort of what the major issues are and how much of that wait and see is going to have to happen.
I think what's going to happen, and again, trying to predict the future, in Israel, we've seen that as certain groups have gotten their vaccination rates in the high range, infections and hospitalizations and death are dropping in those age groups. And I think when we start seeing people not getting infected, not getting in the hospitals, going back slowly more into normal life, then people are going to say, oh, this is great, we ought to get the vaccine. So I'm hoping that we're going to see an acceleration. At the current pace we have in our country, we're going to get to that magical herd immunity threshold, about 70%, in about 11 months. So I'm hoping that we'll have an acceleration and we'll get there more like in 6 or 7 months. I don't want to wait another year.
You and me both.
I would cop out as well. Predicting the future is very difficult, so it's hard to know at what point, or if this group that's intransigent when they give us their attitudes at this point will actually translate those into behavior in the future. It's hard to know. I would say there may be a little paradox here in what Carlos just said as my final remark. If people get vaccinated and if these anti-vaccinators, the hesitants, look around them and see that things are going back to normal, things are opening up and all that, they may paradoxically say, well, I don't need to get my vaccine after all because everything's going normal without my having gotten it. So there may be a little of that in there as well. But my bottom line is I don't have a bottom line in terms of your question exactly. Will we ever see this intransigent group say, all right, I'm going to go get the vaccine, or will they hold out forever? So we'll just have to wait and see.
Well, thank you for entertaining my invitation to forecast the future. I actually got more out of you than I expected in terms of predicting things based on complete guesses at this point. But this is unprecedented time, and we really do value your time and consideration. Thanks to all of you for sharing your thoughts and answering our questions on public attitudes about the COVID-19 vaccines. And thank you to those of you who joined us for this afternoon's program. We hope you found it helpful. We hope you learned something useful. Something that will help us all work together to vaccinate America. Please plan to join us tomorrow for the next part in this important conversation. We'll be joined by experts from the Rockefeller Foundation and Civis. They'll share insights into the messages that work And executives from Amazon and Walmart will explain how they're planning to support the vaccination process of the more than 3 million people who work for them in all 50 states. As always, please contact us if you have questions or topics you think that we should address in the future. You can learn more about the U.S. Chamber of Commerce Foundation at uschamberfoundation.org. Thank you again for your time and consideration. Stay safe. Have a nice day. See you tomorrow.